fortunate to have with us Dr. Suresh Raghavaiah, a distinguished liver and pancreas specialist and multi-organ transplant surgeon trained at prestigious Mayo Clinic in Rochester, USA. Dr. Suresh has led his team to perform the highest number of pancreas transplants in the state, and that's the third highest in India. With expertise in liver, kidney and pancreas transplantation, Dr. Suresh is also a renowned expert in treating complex liver conditions such as hepatitis, jaundice, cirrhosis, liver cancer and biliary diseases, making him a leading figure in this field. I am so glad we are right here with him right now at Spandana Hospital, Mysore Road. Welcome to the show, Doctor.
Pleasure to be here, Ms. Mansi.
We've got like a series of questions that people have asked.
Okay.
So these are the frequently asked questions, especially when it comes to transplant.
Sure.
And because this is the infection prevention week, I wanted to focus on it from Spandana Hospital. Now, this is the next question is kind of related to the COVID vaccination.
Of course.
So it's like you have a transplant. And then what if you get COVID? So you take a shot, right?
Yes.
So can we not just take all the shots of all flus and everything else so that we are completely immune? There's that immunity against everything.
Sure. So, number one, we do not have vaccines against all infections. So that is the number one thing. But we do have good vaccines for commonly occurring infections, like the flu vaccines are there. So indeed, before our transplant, we always vaccinate our patients against all this. Influenza, meningococcus, typhoid, and if the patient has not been vaccinated against hepatitis B, we vaccinate the patient against hepatitis B as well. And recently, we started vaccinating people against HPV as well, human papilloma virus. So all the commonly available vaccinations, we give it to the transplant patients. Why? Because in case they develop an infection after the transplant, they will be in a much better position to fight the infection. But unfortunately, till now, we do not have vaccines against all the known infections of the world. So yeah, it is a work in progress. But yes, before the transplant, we do vaccinate our patients against all available vaccines.
Okay, let's say somebody got infected. What are the available things when it comes to infection? Do we have, protocols in set, and also do we have vaccines for all infections? Can you also tell us what infections are really bad, and what infections are okay, handleable? How does this actually work for a transplant patient?
Sure. So when it comes to a transplant patient, the timing is very important. So what happens during the first 2 weeks after a transplant, the patient's immunity is almost zero. Now, why does this happen? Because we give them medications to shut down their immune system. Why? Because you had a transplant, your body is going to reject your organ. Why? Because this organ is not yours, and the body is going to try to fight it off just like an infection. So, to prevent this, we give you medications to shut down your immunity. So, now what does this happen? This puts you at a very high risk for infection. So, in the initial bit after the transplant, we cover you with antibiotics, antivirals, antiprotozoals and antifungals. For the first week to 10 days, you're on heavy doses of all these medications in order to fight any infections which you might have. Now, after about 10 to 14 days, we know that your immune system has accepted your organ. We know that you do not have an infection at that time. So what gradually we're going to start decreasing your antibiotics and your medications which we give you. We also decrease your amount of immunosuppression medications we give you to titrate it to a particular level where you're not rejecting the organ, but your immunity is still maintained enough to fight off any infection which comes. Now, in the first few days after the transplant, bacterial infections is what we worry about, because bacteria is everywhere, and during a transplant, we open your intestines. Most of the time, we open the bile duct, which can be infected, and bacteria from the intestine can leak out. So that's why we are more worried about a bacterial infection. Now, if a patient has been on antibiotics for a long time, what do we worry about? We worry about a fungal infection. Why? Because we've given so much antibiotics that your bacteria is all dead, and now the fungus in the body starts to proliferate and you can develop invasive fungal infection. Now, when do we give antifungals? All patients get a basic level of antifungals. But if you had multiple surgeries, if you've been in the hospital for a long time, if you had multiple dialysis sessions or plasmapheresis sessions or multiple other invasive tests to be done, we cover you with a higher antifungal. Now, viral infections, especially like something like a CMV in case of a liver patient or a BK virus in a kidney failure patient, usually happens much later, maybe about 3 weeks, 3 months later. And this is the reason we cover the patient with antiviral like valganciclovir and whatnot to that particular extent where the risk of infection goes away. Now, the good thing is once we cross the 3 month benchmark, the risk of rejection is very less. The liver has been starting to work very well, the kidney would have started to function very well, and at that time we continuously decrease your immunosuppression to the bare minimum level where the risk of an infection does not become normal. You'll always be at a higher risk of infection compared to a normal person, but it becomes manageable.
Interesting. That leads me to the next question, which is again, I thought it was a little funny, but in the context that they're in. We have talked about viral, we've talked about bacterial, we've got fungal infection.
Right.
Of the three infections, which is the most dangerous?
There's nothing called as a safe infection. All infections are bad, especially in a transplant patient. Why? Again, your immunity is not good. Now, when it comes to bacterial, if it is a community acquired infection, what does that mean? We're going out, somebody had an infection and they gave it to you. Those are much safer. Why? Most likely, they are going to be sensitive to simple antibiotics. But a bacterial infection, the same bacteria, if you get infected inside the hospital, that bacteria is most likely going to be resistant to the commonly used antibiotics. So this is what we call multi-drug resistant infections. So if you get a multi-drug resistant infections like a Klebsiella, which is the most worst infection you can get right now, there is no antibiotic which can cure that. So you are going to unfortunately suffer the consequences of the MDR infection. Having said that, there are good antibiotics or combination of antibiotics which we use, which do get better. Invasive fungal infection is always bad. You do not want to have a fungal infection, and that generally happens, thankfully, very, very rarely. Like I said, in very sick patients or who've been in the hospital for a much longer time receiving a lot of antibiotics. But by and large, if you develop an invasive fungal infection, I have not seen any patient survive it. So there is no safe infection. The only safe infection is no infection.
Great. Now we have a caregiver who has asked this question. Because you give the drugs, obviously there are no symptoms or visible symptoms.
Yes.
So in that case, how do you diagnose it? What kind of tests are generally used to diagnose these infections?
Very good. So this is the reason why after any transplant, we ask the patient to be under very close follow-up. So when they are in the hospital, until the time of discharge, we test their blood every day for any signs of infection in the blood. We obviously clinically examine the patient, but like I said, in a transplant patient, because the immunity is low, they might not show overt signs of infection, and this is the reason we check them every day with their blood tests. We check their total count, we check a level called procalcitonin, which will give us an idea of the level of infection, and other markers are there which we test every day. Now, once they get discharged from the hospital, we check them twice a week. We call them twice a week and we do all their infection markers to make sure they do not have any infection. And now this is not set in stone. Now let us say the patient had a blood test today. He went home today evening and he doesn't feel well. We don't wait for the next 3 days. We tell him to come back immediately the next day and get their blood check-up done to make sure there is no any infection. Now once, like I said, once they hit the 6-week mark, generally the risk of infection comes down, and that's when we tell them that once a week blood test is enough unless they feel any other result. So for the caretaker, my answer would be, you don't have to worry about it unless the patient is having any signs and symptoms. We're going to immediately check their blood for infection. But if they don't have any symptoms, we will keep a close follow-up on the patient and get them routinely tested for any signs of infection in their blood.
Great. Doctor, the next question is, we've talked so much about infection. Is infection and success of the transplant correlated? And if yes, in what way, to what extent?
Lovely. So this is a beautiful question. How do you define success of a transplant? The success of a transplant is the patient got better and he went home. Or for that matter, any treatment, any surgery, what you want, the patient should undergo the surgery and go home. And that is what determines success of the transplant. Yes, if you get an infection, the course of recovery is going to be much prolonged, much complicated. The patient is going to stay in the ICU for a much longer time. He's going to get a lot more blood tests than what a normal patient would have got. He's going to get a lot more medications than what a normal patient would have got. And like I said, if it's a multi-drug resistant infection or a fungal infection, the patient might not survive the infection. So when you say, is the success of a transplant related to an infection? I would say 100% yes. The hope is only two things when we do a transplant: that the organ starts functioning immediately and we do not have an infection in the recipient. So I would say the success of a transplant is directly related to whether the patient gets an infection or not.
Great. To conclude, if there are three things that you would suggest in terms of lifestyle changes, so that people in general, not just the transplant patient, people in general can prevent infections coming to them, what would be the top 3 or the top 5 things that you would say?
Lovely. This is a beautiful question. What puts you at risk of infection? Immunosuppressed condition. Now, what are the general immune suppression conditions? Diabetes. Diabetes is very easily preventable by healthy lifestyle choices. What are the healthy lifestyle choices? Eat healthy, exercise. It's very simple to say, but it is very difficult to follow. So everybody, 30 to 45 minutes of exercise per day. Avoid sugars. Eat a lot of green leafy vegetables. Eat a lot of fruits and avoid high calorie diet. This itself will put you in the top 90% of healthy people. Second thing, obviously, there's a lot of junk food available outside. There's a lot of pani puri stalls, everything available. We do not know how hygienically those things are made. The easiest thing to do would be to avoid those things. Okay, maintain a healthy lifestyle, exercise regularly, eat good food, and the last thing I would say is, whenever any other patient with infection is there, keep a distance. What you were doing in COVID is the best thing. Wear a mask while going to crowded spaces, use hand sanitizers generously, and drink boiled and cooled water or bottled water. I would say those would be the top 3 things to do to avoid infections.
Thank you,
and
doctor.
Most importantly, seek medical help whenever you feel sick and do not self-medicate.
Most important.
Yes.
Yes, most important.
Yes.
All right. Thank you so much for this, doctor. That was
Thank you,
quite a bit of
Manasi.
information. And with that, we come to the end of this episode. Thank you, doctor, for patiently answering all those questions for us. Health challenges can be, whether it's physical or mental, can be very scary. At Spandana Hospital's Mysore Road, we have specialists from all domains. So feel free to ask away your questions and our specialists will answer it for you. You can leave your questions in the comment section below and we will pick it up for our next episodes. Thank you for watching.